amazing smell. On a good day, they can smell all the McDonald's within a 10-mile radius. Can you believe that? And then they can smell something buried 40 feet underground. In hearing, they hear 4 times further than we do. So if we hear it at 20 feet, they hear it at 80 feet. And then they hear, as you probably know, many different frequencies than we do. Their sense of taste, however, dims by comparison to ours, which is why they are not discretionary eaters. They have 1,500 taste buds and we have 9,000. I bet you didn't know you had that much going on in your mouth. So their sense of vision and touch, they see much better at night than humans, and they can detect movement easier. The further apart their eyes, the more that they can see. They do see in color, but not as much as we do. And their sense of touch is highly refined. It's similar to humans, they say. So when you touch your dog, it will reduce its heart rate and calm them down. And friendly touches will strengthen the emotional bond, just like humans. However, they have a unique ability to communicate through body language. Dogs avoid eye contact with one another. They go around the rear and sniff. And direct eye contact could be a threat, you know. So they have ways of communicating with each other and communicating with us. They know how to tell you when they're relaxed. They roll over and show their belly. When they're friendly, they are wagging their tail rapidly. And here's the dog tail translation. So I know when my dog is stalking something at the park because her tail goes straight out. When her tail goes down between her legs, most of us know that the dog is experiencing something unpleasant or is scared. When the tail goes straight down, that's being submissive or they're concerned. You may see that when they're scared of somebody. And when the tail is high, straight up or wagging, they're very excited and happy. So dogs are expanding their territory. We're seeing them welcome in more and more places, outdoor patios. You may be seeing them these days. They're at fairs and festivals. And we are seeing, like, the Deer Park Mall near where I am. They have little dogs welcome signs in the windows, and many of us have seen them at Home Depot and various other places. So they're becoming more and more welcome in various areas. So getting into animal-assisted therapy, we consider that a non-pharmacological intervention. And usually there's a goal, and we're trying to enhance mental, emotional, and social functioning. We look for animals that are good in temperament, and of course they have to go through some training, which we'll talk about. So generally speaking, for any of us, the pet effect is that you will generally find better energy, more focused attention, and have some increased socialization when an animal or dog is present. What I find fascinating is in as little as 15 minutes of interaction with the dog, and it does not require touching the dog or directly interacting with it in any way. You could just be observing or watching. You will get physical, psychological, emotional, and social benefits out of it. So let's start with the physiological benefits. The heart seems to take the biggest hit in terms of benefits here. We get lowered blood pressure, lower cortisol, which is our stress hormone. Sorry about that. It stimulates brain activity, improves cardiovascular health. There have been studies that show that some people with regular interaction with a dog are able to reduce their medications and sometimes diminish pain. So there was a study with people who were hypertensive, and those that adopted a dog, their blood pressure declined significantly within 5 months as compared to those without a dog. They also observed that pet owners, and this could include cats, have lower triglyceride and cholesterol levels. And if you do have a heart attack, those who have a pet survive longer. And they also found out that people 65 and over make fewer visits to their doctor when they're a pet owner. So you can lower your blood pressure by 10% spending 15 minutes with a dog in a quiet room. And they've observed that dog owners interact with strangers up to 21 times more often than non-dog owners, which is true. You walk the dog around the block and you do get to meet the neighbors. My ex-husband used to call my dog a chick magnet. All the ladies wanted to stop and see the dog. The number of minutes walked per week by the average dog owner is 300 minutes a week. Okay, so dog ownership is associated, and this was a cross-country study. They studied numerous countries, 24% reduction in mortality. So dog ownership can lengthen the span of your life. And as just said earlier, that if you've suffered a heart attack or stroke, you're 31% less likely to die of cardiovascular disease. However, this study was criticized for not controlling social or economic status or disease factors. So they question, is it the dog or the behavior? So more studies needed there. And this is an organization that does a lot of studying. They do research in 3 major areas: child health and development, healthy aging, and mental health and wellness. So their website is there, habri.org, if you want to look at any of those studies. So stress reduction also comes under physiological. I used to say that no matter how bad my day is, when I come home to my little tail wagging friends, that they change my mood and make my day. And so numerous studies have been done to document the stress, the reduction of the stress hormone, cortisol, which we said earlier. So dogs can quickly change a mood for the better. And they studied a Medicare program and found evidence of those with animals had the fewer doctor visits than those without pets. And animals are a stress buffer, and it does help our ability to cope through things. So maybe those of you with dogs can attest to how your dogs are helping you, or your cats are helping you to cope through COVID and our shutdown. I know the dogs were happy. In 2002, participants put under a performed timed test, and it was in math. So math makes some people nervous. They found those who had a dog in the room compared to those who didn't. Those with a dog made fewer errors on the test, and that petting the dog lowered stress, cholesterol, and blood pressure. So when we walk our dogs, is our mind full or is our mind full? Dogs are staying present in the moment, while people always have a lot of things running through their mind. So mindfulness is a stress reduction technique. And if, when on a dog walk, you could just begin to stay in the moment and try to identify all the different colors of green, identify the sounds that you hear, maybe differentiate between bird tones, notice the smell in the air, what you feel. In other words, use all 5 senses to just be present in the moment without your mind racing in different directions. And that will help as a stress reducer. So your dog can lead you in that direction. We also found physiologically that people with animals have an increase in their activities of daily living. So more walks, scheduled meals, scheduled bedtime, maybe playtime. And they also studied seniors who have pets and found those with dogs showed greater ability to climb stairs, bend, kneel, or stoop, because you're doing those things when you have a dog. They were also better regimented with their own meals and their own medications. And I don't know what a dog has to do with this other than they follow you to the bathroom, but they said that the study found you're more likely to bathe and dress oneself if you're a senior with a dog. And this study found no difference between dog and cat ownership. So that's good news for cat owners. So psychological benefits: improved mood, increase in serotonin and dopamine, our feel-good chemicals, neurochemicals, increase in the relaxation response, which is our parasympathetic nervous system, gets turned on when we're interacting with dogs. And it can enhance the quality of life, and also release of endorphins, especially oxytocin. So if you make eye contact with your dog, simply looking at your dog in the eyes, it will increase your oxytocin as well as your dog, while increasing the bond between you. And oxytocin, maybe some of you know, maybe some of you don't, is considered the love hormone or the cuddle hormone. It gets released when a mother has a child in order to increase the bonding. And what I find interesting is that for humans, 30 minutes with your dog will increase your oxytocin, but for the dog, it's only 10 minutes with their human that it increases their oxytocin by 50%. So you want to make your dog feel good, spend 10 minutes with them. And sometimes just thinking about our dogs can increase our oxytocin. So increasing oxytocin with human is making eye contact, hug, holding hands, kiss, playing music, and dance. You can do all those things with your dog as well. Okay, Raina, as said already, it increases your feel-good neurochemicals. So dopamine, serotonin, oxytocin, and endorphins all play a role. And just thinking about a dog for just a few minutes will change your mood through your neurochemicals. This sad picture tells the story that dogs can help us cope with grief and loss. It's particularly true for singles or widowed, and they ward off loneliness by 36%. And this one study found it to be true, particularly in women. Although somebody in England did ask the question, because they studied over 5,000 people, were pets a response to loneliness? Meaning, did only lonely people adopt pets? All right, and children, they did a study where they brought kids to the doctor, and one group had a dog present in the room and the other group did not. They found that for the children with the dog in the room, they had lower anxiety, lower blood pressure, lower heart rates, and less distressed behavior. So find a doctor who has a dog. And in a study with children with ADHD, they found those who read to dogs showed improvement in many areas. Their behavioral problems, they were more cooperative and did more sharing. And their comparison control group was a stuffed animal. So dogs were better than a stuffed animal. And autistic children, when they had a dog present compared to a toy, were calmer and more interactive. We also know this to be true of abused children. Studies on depression in South Africa for seniors, we found a 50% reduction in geriatric depression scales, a reduction in anxiety by 24%, and an increase in a mental status exam by 4 points. And so those with dementia often will have a very positive and spontaneous recall of pets they once knew. I remember when we were taking the dogs, there was a woman from another country, and she grew up on a farm, and they had all kinds of animals, chickens, horses, donkeys, etc. And every time I brought the dogs, she would run through all of the animals, and it just brought her such joy and had her in such a positive mood. Interacting with the dog can reduce agitation and can be really useful to offset sundowners. And they're a good source of positive nonverbal communication, which we need sometimes in the later stages of dementia. So emotional benefits, you're already seeing that they lower anxiety rates, increase self-confidence, opportunity to show caring, and they bring and teach responsibility. So children can learn to develop empathy and higher self-esteem because they can learn how to engage and master control of the dog. And it increases social and physical activity, and For an only child, well, even when you have multiple children, a dog becomes part of the family and becomes like another sibling. And they can also provide an increased sense of security. What do you think of this dog? Sometimes just bringing a dog that looks like that into a facility can really brighten the day. So, temporary dogs are usually therapy dogs. Sometimes they're called comfort dogs, and research has proven that they provide good companionship to children and the elderly who may not be able to have a dog of their own. And children with autism, as just said, can experience increased focus and interaction. Also trust and safety, I have found. In nursing homes, we have found that they increase social behavior, not only with the dog and its handler, but between residents. We saw that a lot in memory care. And as said earlier, it decreases loneliness and better performance on tasks when a dog is present. So where do we bring temporary dogs or comfort dogs? We bring them to traumatic events like 9/11, natural disasters, school shootings, hospice, cancer wards. Oops, yeah, that's temporary dogs. Okay. And so social benefits of dogs, some of this is going to be redundant because it crosses over into these other areas, but reduction in loneliness and isolation. And people who live with their dogs most of them will confess that they talk to their dogs. So better than walking around talking to yourself, you're now walking around talking to the dog. You're also giving the dog an animated voice to talk with other family members, which can be funny and sometimes can be sarcastic. So socialization, to be touched or touched. A lot of people, especially now with COVID, are not touching much, but if you have a long enough leash, people can interact with your dog. And it's a point of connection. It can reduce boredom, etc. So dogs just increase social engagement. They become a medium of communication through all kinds of settings. And again, bring a dog with rabbit ears, what's going to happen? A whole lot of conversation. So residents in senior communities were more alert, had longer conversations. They increased socialization between each other. And family members, I found this to be true, were more likely to visit longer when the dogs were present. So we would walk in oftentimes and family members were about to leave and they saw us with the dogs and they stayed another half hour or 45 minutes. So everybody benefits. And just a couple of examples of how I've utilized dogs in therapy that have had breakthroughs is one guy who seems extroverted, but he's really introverted, and his wife recently had him get a dog for the son, and now he, of course, is the one taking care of the dog and is taking it out for walks and to the dog park, etc. And he is getting to meet all of the neighbors. He's making new friends at the dog park. And it has opened up a world for him. Another woman who was on disability, I'm calling her Carol Burnett, and she was basically shut inside with her disability. She couldn't work any longer. She didn't go out much. So we had her get a dog, and she got that dog into classes and got into therapy dog classes. She graduated with her dog and has participated in visiting numerous facilities, including veteran facilities. It has changed her entire world. And then Shirley Temple, I'll call her. She, another person who had retired, had no children, no husband, was feeling very lonely with no purpose. She rescued a dog, changed her life as well, increased her sense of satisfaction, gave her some purpose, and her depression significantly decreased. And unfortunately, Shirley Temple recently was injured and is grateful to have her dog at her side now. So personally for me, how it's increased social contact is lots of walks in the park. The children always gravitate and interact, and I love children. I've met new friends, all the training classes Our therapy dog team, interactions at the office, everybody gets to know the dogs, and I stop and interact with everyone around the dogs, the kids in the neighborhood. I've joined charity walks that are pet friendly and attended expos and black tie fairs. So there's plenty to do with your dog. Now, because of artificial intelligence, they're starting to do studies, and they're finding out that people can benefit the same way from a dog that is a toy or a robot, especially if it has voice and is interactive. So maybe some of us can relate, because how many of you talk to Alexa or talk to Siri? It's sort of a companion. All right, so this is kind of fun. 98% of dog owners consider their dog a family member, and more than half of the pet owners surveyed said they'd choose a dog over a person to be stranded on a desert island with. What would you say? Over 80% of pet owners showed that they regarded their dog as a reliable go-to resource for affection, unconditional love, stress relief, and relaxation. And I often hear the complaint with couples say, "You love that dog more than me." So it's the unconditional love, I think, that really draws us towards them. And 75% of owners surveyed said that they have improved mental health as a result from having a dog. So for our purposes here, differentiating the dogs, there's a service dog, a therapy dog, and an emotional support animal. What's the difference between these dogs? Basically, it's who the dog is targeted to serve and where the dog can go. So a service dog is a working dog. It is trained specifically to assist the owner in some capacity. A therapy dog is trained to serve the needs of others, and an emotional support dog serves the owner only. Ironically, the therapy dogs who are the next well-trained under service dog are the most restricted. They're not freely allowed on flights. They're not freely allowed in buildings where dogs are not allowed. They cannot be brought into work settings without permission, and they can't just go into grocery stores or other places where dogs are prohibited. A service dog can go anywhere, and an emotional support dog is able to get special permission for flights and for landlords. So, what is a service dog? Trained for a specific service to humans. It usually has a specific job. It can go anywhere, as just said. And it cannot interact with the public while working. So when that dog's at work, you have to refrain from trying to interact with it. Service dogs include a guide dog, a hearing dog, mobility assistance dogs, diabetic alert, seizure alert, and seizure response. There's 2 different seizure dogs. I didn't know that till I was putting this together. There's psychiatric service dogs, autism support. There's even dogs trained to deal with fetal alcohol syndrome, allergy detection, disaster search and rescue, and law enforcement dogs. And now I will proudly introduce Lake County's local hero. Maybe some of you know him. He's Canine Dex, and he works for the Sheriff's Office. He was a finalist in the 2019 American Humane Hero Dog of the Year Award. And that's a 132-year-old nonprofit organization that recognizes ordinary dogs doing extraordinary things. And so Canine Dex traveled to Hollywood for the ceremony. Good dog, Dex. Okay, and the purpose of an emotional support dog, it provides emotional support or comfort to the owner, doesn't serve any purpose in the community, and is not trained to serve other people. They require a prescription from a mental health or healthcare professional. No special training is required. And as said, you can get a letter for your landlord or airline. The criteria is getting stricter these days because, as you may have seen in the news, people are bringing questionable emotional support animals onto planes, such as pigs, boa snakes, peacocks, etc. All right, and a therapy dog, it has to be good-tempered to begin with, and it usually lives with the handler, and it has to undergo certain levels of training. So it's got to get through your basic puppy classes, and then it moves on to Canine Good Citizen Test, which basically is that it has good manners to be in public. And then it moves into therapy dog classes, and then it has to pass a therapy dog test, which has a variety of tasks on it, one of which the hardest is a 2-minute down stay. That's very hard for dogs to sit in a down stay for 2 minutes. And then they have to do a little doggy internship, which means they have to do supervised visits at a facility and get signed off on. Then they can apply for their therapy dog certification, and then they have to become a member and get the insurance. So all of that's required to be a therapy dog. Now the AKC recognizes several of the therapy dog certification programs. As you know, there's lots of stuff online. You can just go sign up and have some kind of little badge or something, but those are not all recognized as being legitimate. And so what they are recognizing is TDI, which is Therapy Dogs International, Love on a Leash, Pet Partners, Alliance of Therapy Dogs, Bright and Beautiful Therapy Dogs. Okay, so therapy dogs go to all different kinds of sites. It can be any facility or organization who invites them. We don't charge the facility. We're all volunteers. You have to be sure you're certified and credentialed, and you have to carry those credentials with you and wear the special harness. And the therapy dogs are not under federal rule. We're not protected by the ADA, which is why we're more restricted on where we can go. And Love on a Leash started in 1980. It's active in 47 states. So we have 2,600 active dogs serving, and we have local chapters. So the names of some of the dogs that we have in our local chapter are Duffy, Mila, Maple, Dexter, Cooper, Schnooks, Lana. And here we are at one of the local facilities. Lana is the big dog on the left, Schnooks is in the middle, and Mila, May, and I are on the right. And our chapter has gone to hospitals, rehab facilities, assisted living, memory care, senior centers, schools, and libraries. And due to COVID, our team is not meeting. So that's sad. You see somebody there who's bringing a dog outside the window. That was possible, but as facilities got stricter, they wouldn't even allow people on the premises. We're hoping to go back someday soon. So if you want to contact Love on a Leash, it's loveonaleash.org. They do provide a brochure and a handout that tells you a little bit more about the differences between dogs and more about their organization, if you'd like to see. Now, I think we have enough time. I can, let's see, will this play? Hang on one second. Well, I guess it's not going to play. Carol told me that they had trouble with videos anyways, but Lexi spins the wheel on this one. She was invited to the annual pet show at Arlington Heights Racetrack by her therapy dog trainer, who taught her how to spin the wheel. So when you give her instructions to spin the wheel, she spins it, and if you tell her jackpot, she spins it multiple times. It's quite amusing. And this one is where she learns how to unroll a mat, a yoga mat, and inside the mat are treats, but she has learned to unroll it, and then she rolls it back up. And this one is Lana Goes Through a Tunnel. We're at a facility here, and we have been to this facility for a couple years, so we know we can let the dogs off leash. And there's a tunnel that we brought. It's an agility tunnel, And Lana, the big dog that you saw earlier, goes through the tunnel. And the residents all sit and watch. It's quite fun. And then Mila and Lexi in this video were learning how to jump over the pole. So they know how to go under and they know how to go over. And sometimes we would bring this equipment to facilities and again, show all of the residents or children. And then this is Marianne, one of our colleagues in the chapter. And here she had all the dogs in a sit down stay. And we filmed it just to show that they were in uniform in their tricks. And she passed out treats afterwards. And this is a reward at the end of a long day. It is the two dogs, mine on the couch, and they're sharing a bone. Okay, so to wrap up, there's more reasons to interact with therapy dogs than not to. The research is growing rapidly in this area, and the more we adore our dogs, the more research they're doing. Currently, the research supports benefit of therapy dogs with all ages, benefit of dogs just in health and wellness generally. And they bring energy, joy, and fun to all, so it becomes a win-win. And together, we can all experience the healing power of the human-animal bond. So I want to thank you. I know we have some questions, and I'll leave up this slide of if you have any reason to contact me in the future. Thank you so much for your attention, and I'll look forward to your questions.
Thank you. We do have some questions. So one of them from one of our participants is, my dog is certified by Canine Therapy Corps in the city of Chicago. This is a very intense and difficult test. He works in a hospital with stroke rehab patients, which is wonderful. My question is, or from the person who put it in, what can I do to use these certifications to do visits at nursing homes? He would not be able to go visit at the nursing home with his Canine Therapy Corps vest on when he's not working for Canine Therapy Corps.
Well, I would say if they have no objections to you participating in another organization, you could contact one of the organizations I mentioned, find out what is required to be a visiting therapy dog in their organization, and then see if you meet that criteria. There are organizations that are not so strict, and they may just let you come in the doors. But it's per organization that they make those decisions.
We have another question, and I think you might have answered this along the way, but are there best, quote unquote, dogs for service dogs? And if a dog is fairly mellow, does that mean they can automatically be a service dog?
Lately, they've been using all shapes and sizes for service dogs. So that's really a good thing, I think. Hang on a second. Let me get you back to my screen. Whoops. They don't disqualify a dog unless it's unable to perform the tasks at hand for whatever it's being trained for. Did I answer all the question or just part of it, Carol?
Let's see. Just a moment here. I was just saying if there were more. If a dog is fairly mellow, does that mean they can automatically be a service dog?
I wouldn't say that they can automatically be, but they probably would be good temperament for certain types of service dogs. I would think people with PTSD, seeing eye dog, anybody with chronic health conditions, maybe even a seizure response dog.
Well, I think there's been recently some other issues where I've seen this happen, where someone got a dog and it was really a wonderful dog, but it was they got it as a puppy, and it was a shepherd and was not properly trained, but the dog was very affiliated to the owner. So the owner ordered one of those little I am a service dog vests online and
Yeah.
started taking this dog everywhere. Is there any way to prevent that kind of thing?
Well, yes and no. No, you can't prevent them from going online and getting themselves a vest.
Right.
But when a dog is in a facility, you can ask for their credentials. They're supposed to be carrying their ID and their credentials to prove that they have what it takes to be there.
And someone also asked, is there a particular breed or type of dog? What does make the very best service dog?
Well, traditionally, the ones that we've seen the most are shepherds and Goldens and Labs. Those are traditionally the ones we've seen. But again, they are starting to use all types of breeds. We liked our therapy dog team because we had 3 different sizes and 3 different kinds of breeds. And so it made it interesting. There was something for everybody. But you don't always get that to be part of a
Yeah.
team.
And I've seen also another presentation or 2 that you've done, Dr. Casey, with Love on a Leash, with all the people that are there. And really, it was just fascinating. And we were hoping we could do this in person, online. And in the future, if things lighten up somewhat, maybe we can do that. But we weren't able to tonight, obviously. But the dogs were just, people were like mesmerized by them. And Dr. Casey was speaking and doing a wonderful job, but everybody was watching the dogs. And the biggest dog, all of a sudden I looked over, had hopped up and was sitting in the lap of the owner. It was like 2 people on a chair. It was really very, very cute. Does anyone else have another question? Let's see. We do have another one. Someone said, I understand that you cannot ask a person what their disability is and why they need a service or comfort dog. Is that correct?
It's politically incorrect. It's also a violation if you're in a circumstance where legal could be applied.
And I think that's what the question was. That's good to know. Go ahead, I'm sorry.
I have heard complaints of people who use handicap parking spaces of being assaulted by others with questions about, you're walking just fine. What's wrong with you? Why are you taking that space? Whether they had a dog with them or not. Yeah, it's rude.
Also, let's see. Okay, to visit a nursing home with your dog on your own, do you need liability insurance for your dog? And I guess my question is, I know there are some facilities. Tiffany, do you allow people to bring dogs into your facility?
Under normal circumstances, I've been in senior living for 18 years. Most of the communities that I've worked in, we did allow visiting pets as long as they were leashed and would be safe for the community. So we would kind of do a bit of an interview, because certainly we want to make sure that a dog isn't going to pounce on a senior and knock them over. And, some of them have pretty strong tails too. So that was kind of left up to the individual community, but that's usually how it's dealt with.
Right, that's what I've seen. And Dr. Casey, someone asked if you do bring a dog in, should you have liability insurance? My answer to that would be definitely.
Yes, and all the organizations require you to have it. So if you're certified through an organization, then you have to have it. They usually provide it for a fee. Also, I think it's a good idea to get some information about bringing dogs into facilities. One of the things I quickly learned was you have to protect the people from the dogs, right? And, older communities, you have to be careful. They want to put their paws up their skin is thinner, you know, just the dog's paw touching them. If they scratch the skin, it could cause a bleed or something. So we've been instructed quite thoroughly on, you know, bring a blanket with you, do paws up, not on the person, but on their walking assistive devices and so forth. The other thing I learned quickly was you also have to protect the dog from the people.
Yes,
Um,
definitely.
that was a shocking surprise to me. So yes, it's when you're there as a therapy dog handler, it is not a relaxing visit for the handler because you're trying to monitor all interactions always and keep everybody safe. But
Sure.
it's usually delightful.
One of the things too I want to make mention, sorry, Carol, is
Go right ahead.
a lot of the people that we've had come in over the years specifically asked if we had someone who did not like dogs. And I think that's just as important of a question because very often, especially people with cognitive challenges, if they've had an episode where they were bitten by a dog or had a disturbing encounter with a dog, it can set off some behaviors that, you know, just are not good. So
Exactly. Very important point. Thank you for bringing it up.
Yes, I think also my mother was in skilled care at 92 and had extreme dementia issues and had always been very afraid of cats her whole life. We never had a cat for that reason. One had jumped on her when she was a young girl and she never could get over it. And so we had friends that had a cat and the cat was always kept its distance or put in another room when we go to visit them and so forth. So she moved in there, was in this facility, and I went to visit her. I was out of state, so I wasn't there all the time. And all of a sudden I looked down and this very large older cat was coming over towards her. And she goes, "Oh, there's Molly. She's such a wonderful cat." Okay, well, there's a
wow. Always an adventure, Carol.
Yes. We have a shout out, and Jennifer is not on the call tonight, but I'm sure it will come from her as well, so I will include that. But we have a shout out from Gail Nexick at Elderworks, my colleague. Thank you so much for giving Cruiser and Shadow. I might say Shadow as at every Zoom meeting we have. Very important role in the presentation tonight. And we appreciate you giving Scruffy, the Elderworks dog. It is Jennifer's dog, but a very important spot also, as well as all the other dogs. Again, this was recorded. We do apologize that we had some difficulties tonight coming through Zoom and Eventbank. But do send in your evaluations. We will, of course, be giving CEU credit. And Denise, we thank you very much. I'm sorry that we had some difficulties, but you certainly stepped up to the plate. And we thank Arborteris very much, Jocelyn, as well as Tiffany, for joining us and sponsoring tonight. They're a wonderful community, assisted living and memory care. And we really want to encourage you to visit their community. Of course, you'll want to come through Elderworks so we can send that referral for you.
Definitely, definitely. And certainly any senior information we can provide, don't hesitate to connect.
Oh, we do have one last quick question here. How often do a dog and owner have to renew the certification?
It's annual.
Okay, thank you.
At least with Love on a Leash, it's annual.
Thank you. Denise, thank you so much. Thank you to Arborteris. Thank you to Barrington Behavioral Health and Wellness. All of their employees and psychologists are excellent. They work with us on numerous programs we do through Elderworks, so watch for those. And again, we're here to assist you. And thank you very much for coming on tonight and for your patience as we work through these new wonderful technical difficulties that seem to be happening all week this week with Zoom. So hopefully next time it'll be smoother. But thanks again, Denise, so much.
And thank you to everybody and all the participants and all of you who supported the program. It's I wish I could see all of you, but nice to be here with you.
Thank you, Doctor. Thank you, Carol.
You're very welcome. Have a good
Thanks.
evening.
Everybody have a great evening.
Good night.